And next, in the main agenda, we will have three speakers: Dr. Carl Snyder from the University of Sydney, Dr. Erwin Martinez Feller from San Pedro College, Davao City, Philippines, and Madam Shirin Binti Alwi from Faculty of Pharmacy, University Malaya, Malaysia. We will close our session with the Q&A later on. Let's begin with the first agenda. For all participants, please position yourself to sit upright for the national anthem of Indonesia, Indonesia Raya. Himne Airlangga.
Sa
Next is the opening speech from Vice Dean of Academic and Student Affairs, Faculty of Farmasi, Universitas Airlangga, Dr. Rista Primaharinastiti, Magister Science, Apotheker. Please welcome Dr. Rista Primaharinastiti.
Okay, thank you, Dr. Yunita. Assalamualaikum warahmatullahi wabarakatuh. Good morning, the honorable speakers from Australia, from Philippines, and also from Malaysia, distinguished professors, participants, ladies and gentlemen. On behalf of the Dean of Farmasi, Professor Dr. Junaidi Khotib, I extend a warm welcome to all speakers and participants. I'm delighted and honored to have this opportunity to welcome you virtually in Surabaya at virtual webinar Sustainable Development Goals series of Faculty of Farmasi Universitas Airlangga entitled Farmasi Education Transformation to Anticipate Inevitable Changes Post-COVID-19 Pandemic. This virtual webinar is part of our 99 years of faculty anniversary in this year, that began creating innovation, gaining recognition, achieving smart university values. 90 years is a major age in the development of an institution, as also a very good momentum to strengthen organization, improve impactful performance, focus on excellence and innovation, expand networking, and gain advantages of technology development to achieve value of Airlangga Smart University. The achievement of these values will be able to boost the academic reputation, graduates' employability, and the recognition of an institution within global scope. Therefore, we would like again to thank you for your coming to be our speaker in this SDGs webinar, Dr. Carl Snyder, Dr. Erwin Martinez-Feller, and Dr. Shirin Binti Alwi. We hope we continue this engagement to strengthen our ongoing collaboration to achieve SDGs main goals, especially in SDGs for quality education. This collaboration will be very meaningful for us. I would like to take this opportunity to also express my gratitude to the organizing committee for their diligence, their full support, and contribution to this webinar. In closing, I wish the participants a very fruitful and productive webinar. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Dr. Primaharinastiti, for the warm welcome and the opening remark. Now we will have a brief photo session. We ask for everyone in this Zoom to turn on your camera on your device. Please give your best smile and the committee will take the capture in seconds. 1, 2, 3, all done. Thank you. Before moving on to the main schedule, let me address this reminder briefly. Each participant is entitled to an A certificate of participation after completing the requirements. First, participants have to attend the webinar via Zoom, and second, participants needs to fill out the attendance list at the link no later than AM GMT +7. The link will also be available in the chat box, so participants can also address the question for the speakers with the format as written on the screen. Okay, ladies and gentlemen, we will start with our session today with our first speakers, Dr. Carl Snyder, to Dr. Carl Snyder to present his topic is Pharmacy Education Transformation Preparing for Change. Hello, Dr. Snyder. Good morning.
Good morning.
How are you?
I'm very well, thank you. And thank you very much for the invitation to speak with you briefly today.
Okay, so allow me to introduce Dr. Snyder briefly. So Dr. Snyder is a registered pharmacist in Australia since 2002. He is also a registered nurse in Australia since 1997. Currently, he is a senior lecturer at Faculty of Medicine and Health, the University of Sydney, Australia. His research interests including the role of clinical pharmacy in the hospital setting, pharmacy services, the use of hospital pharmacy prescribing records to screen for patients requiring therapeutic review, and the effect of the pharmacy environment on consumer satisfaction, and also the use of pharmacy intern exchange agents. Dr. Snyder, you will be having 20 minutes for your presentation. Please, the screen is yours.
Thank you so much. I'll start the presentation now. So, once again, I'd like to extend my gratitude for the invitation to present to you today. I look forward to talking about these topics in additional detail during our discussion. However, in the first 20 minutes, I'd like to take the opportunity as first speaker to talk about briefly what changes might we expect moving forward, during this pandemic and beyond. And as you can see, this is a background of a part of our University of Sydney in Sydney, Australia. So I thought first I should point out a very interesting report by Deloitte on the future of pharmacy. And they subtitled it Disruption Creates Transformative Opportunities and Challenges. And I would like to emphasize the word disruption. Innovation can be predictable, but it can also be unpredictable. And unpredictable innovation is disruptive. Potential disruptions in pharmacy were stated as follows. New treatments could be disruptive. A growth in gene therapy, digital therapeutics, and medical devices may change treatment protocols with 3D printing, allowing custom dosing of precision generics. This may change the supply model of how community pharmacy in primary care provide medicines and medicinal substances to the public. Another potential disruption is delivery. Same-day delivery enabled by bots or drones may shift retail into health destinations. So what we might see is rather than multiple pharmacies, self-contained, having the ability to supply all products, we may see a shift towards a hub and spoke model. Finally, the pharmacist's role may be disrupted through the process of automation. This frees up time to spend on virtual and physical care, while regulations may shift to allow pharmacists to be the next generation primary care providers. Reimbursement itself may shift to value-based rather than scale-based. So scale-based is more about product supply in this case, or quantity of provision of care, whilst driving hyper-localization of care. So I'll also like to point out a few more things that may be disruptive. We see the emergence of automation. Here are some examples of automation across the world. Drones, we see precision dosing, we see automated dispensing, even vending dispensing. One thing to point out if we take a step back is how fast could this happen? What we see is that innovation or the dissemination of technology has become more and more rapid as we've progressed over the last 120 years. If you follow these graphs, you can see the rate of diffusion across American households in terms of technology has become steeper. So time is shorter for diffusion of innovation. If we also look at consumers or patient preferences, what we see is increases in the desire for electronic requests for prescribing, reminders for prescriptions, booking or changing appointments, using remote or telemonitoring devices, and even communicating with your provider through video conferencing. This last one, if this is a 2019 statistic at 49%, we've got data from Australia where we've seen the vast majority, over 75, almost over 80%, seeing video conferencing as a possibility to communicate with health providers. So we're seeing a very much move towards electronic delivery of services. This is also coupled with the consumerization of healthcare. We're seeing a drop in healthcare provider loyalty. We're seeing people moving towards looking at how efficient or how quickly they are able to get an appointment or access such as to medicines. They're also more concerned about price, transparency, and costs than an actual relationship with providers. So we're seeing a drive towards consumerization due to time pressure and cost pressure. Finally, I'd like to point out some examples of what consumers are doing with respect to health information and advice. What we're seeing is that in the vast majority of patients are researching medical questions online. They also go online for answers first thing when experiencing a symptom. They're not going to medical or pharmacy health professionals, they're going online. They also are searching for healthcare professionals online. They look at your online presence in terms of social media. This is something to be aware of as well. If we look forward in terms of digital health, we're also going to see an increase in not just prevention by use of data, but also going to see change in predicting future illness or health risks, management of health risks, and even diagnosis via the use of personalized data, both in terms of wearables, connectability within social networking, genomics such as pharmacogenomics, internet data, and health info systems. So, in summary, there are potential changes, and here are four that I think are very important. Predictive analytics, in terms of predicting future risk of disease. Sentiment analysis, being able to understand through artificial intelligence the sentiment or the emotional state of people. Adaptive algorithms that will actually take in dynamically data to triage symptom management. So we're seeing an increase towards the use of AI to predict how to treat or what management is required or assessment is required for illness or symptoms. We will also see artificial intelligence facilitating personal health coaching. So the questions emerge. How will we supervise automation? What skills are required in future pharmacists in this milieu? Who will develop the code, or who will program artificial intelligence or machines? And how does pharmacy involve there? And who will educate these cognitive agents? So I'm going to move on to some thoughts on how pharmacy education needs to change to prepare for unpredictable future. The first thing, it starts with the selection process, as you can see by a picture by Charles Darwin. We need a diverse profession. There is a McKinsey report that demonstrates that organizational diversity leads to more effective organizations. If we look at executive gender diversity, we see that if you have greater gender diversity, you have increased profitability. Further, if we look at executive ethnic diversity from different ethnicities, we also see an increase in profitability. A greater percentage of companies in the United States are in the top quartile for profitability. So diversity equals improved effectiveness in organizations, in the commercial sector. We also need a diverse profession for pharmacy. I'd like to point out the Nanjing statements. These, if you're not aware, are the FIP, International Pharmacy Federation, statements for pharmacy education and pharmaceutical education. They were produced in 1997, and they are currently starting the process for updating them for the second edition. They state that we need to recruit students that have a profile that fit the requirements of the school and is aligned with the profile of pharmacists desired for the country. But if we look further, it says admission practices should consider the value of a diverse student body. So not only that it reflects the population, but I would also suggest that it would help us in terms of future change. A more diverse profession is more resilient for future change in practice. So how do we then, once we've selected a diverse pharmacy student population, how do we educate future pharmacists? Well, I would like to point out a book by Professor Howard Gardner, who is entitled 5 Minds for the Future. He's a cognitive psychologist. He points out that we need to educate the following 5 minds. The discipline mind, that is, we need to educate strength in disciplinary knowledge, expertise. I think that pharmacy institutions around the world are very strong in developing the discipline mind. We are very good at delivery of content and technical skills and assessment of technical skills. The second mind is the synthesizing mind. And this is to try to draw or synthesize across disciplines. If we look at the curriculum of pharmacy, it is quite strict and controlled. Perhaps we need to think a little bit more about including interdisciplinary knowledge and being able to synthesize across other disciplines. For example, business, education, other healthcare disciplines, law, humanities, perhaps. The respectful mind. This is the idea that we need to practice and value other humans. And I think we also do this well as a health discipline. The ethical mind, that we practice ethically within our scope of knowledge and scope of practice. I think we also do this well. And finally, the creating mind. We need to be able to allow and develop the ability to create, to be prepared to fail, try new things, a growth mindset. If we look at the Nanjing statements and go back to this, they state the school should ensure the needs and future trends in healthcare delivery. Future trends is an important point here. We need to develop and update our curriculum accordingly. If I reviewed the Nanjing statements, I would say that the discipline's mind is well characterized in section 2. The synthesizing mind is referred to in sections 2.9 to 11. The respectful and ethical mind is being referred to as well. However, I think that there is a gap in the current Nanjing statements that there's no mention of creativity, inventiveness, entrepreneurism. And I would like, whether you be an educator or a student, or you've been previously educated within pharmacy, to think whether there was an opportunity throughout your curriculum to be creative, to be inventive, and to be an entrepreneur in terms of commercialization. So my take-home message in these 20 minutes is to prepare for disruption, is to be creative. So in summary, disruptive innovation is unpredictable. The only predictable thing is that it will be unpredictable. Innovation is a constant. That is the only thing that we can predict, and it's increasingly rapid as time has changed, as we've moved forward. The pandemic has indeed been an extremely disruptive event that has made major changes in how pharmacy education has been delivered and also the topics. And I think the next two speakers will speak to that. The implications for pharmacy education moving beyond the pandemic is we need to attract diversity to the profession. We need to allow diversity to flourish within our curriculum, and we need to encourage creativity in pharmacy education to make creative future pharmacists. And I will finish it there. I look forward to the discussion.
Thank you very much, Dr. Snyder, for the very inspiring presentation, the transformation of pharmacy education, and then the implication for pharmacy education because of the disruption and the creative mind that you have mentioned. Please stay with us for the discussion session after the third presentation. Let me move to the next speaker. Our second speaker is Dr. Erwin Martinez Feller, who will give a presentation about transforming pharmacy education through virtual exchange, a VUCA response to post-COVID-19 pandemic. Hi, Dr. Feller, how are you?
Yes, good morning, everyone.
Morning. So I would like to introduce you to everyone. Here is the brief introduction of Dr. Feller. He obtained his PhD in education in the major in educational leadership, specializing in clinical pharmacy education from the University of the Immaculate Conception, Philippines. And he got 3 masters. One is the Master in Science in Pharmacy from University of the Immaculate Conception. The second one is Master in Arts in Theology and Religious Education from the Ignatian Institute of Religious Education. And the last one is Master in Science in Clinical Pharmacy from the University Science Malaysia. This one is ongoing. His current position is Director of Internationalization Linkage in San Pedro College, Davao City, Philippines. He is also a visiting professor at Bournemouth University, United Kingdom. His research interests including community participation in health, health and human rights, health assessment, medical examination, health promotion or health education, HIV/AIDS, infectious disease, migrant assistance, non-communicable disease, preventive medicine, primary health care, public health, refugee health, sexual and reproductive health, and travel medicine. Dr. Fowler, you have 20 minutes for the presentation and the screen is yours.
Yes, thank you very much for that very warm introduction. And I would like to first thank everyone for this opportunity to be with you for this afternoon and for this morning. I know that all of you are very busy in this time of the post pandemic, but then nevertheless, all of us are learning together in terms of pharmacy education and beyond, learning beyond in terms of our academics and co-curricular activities that we have. So my main topic is all about transforming pharmacy education through virtual exchange, a VUCA response to post-COVID-19 pandemic. So I would like first to acknowledge Universitas Erlangga, Indonesia, Dr. Lista, the Vice Dean of Academic and Student Affairs, the UNAIR, Dean of the Faculty of Pharmacy, the administrators, the faculty, and also the students, and Dr. Diagen, the person in charge of the webinar committee, Professor Andy for inviting me, and also the UNAIR administrators, the faculty and student, San Pedro College Pharmacy Department, and students who are very eager to be here. And also our faculty is very supportive. And also the Philippine Association of Colleges of Pharmacy, who actually invited also other university and students to be here for this morning's Sustainable Development Goal webinar. Thank you very much. I would like to welcome you to our place called Davao City, Mindanao, which is actually the most beautiful place, also in the Philippines, and also the home of our Philippine Eagle, and also one of the largest city in the Philippines also. We are actually located in the southern parts of the Philippines, and San Pedro has two major campuses. The main campus in the center of Davao City, and also in Ulas campus, which is located 30 minutes away from the city. So these are my very exciting content that we have. So I'll be tackling about VUCA and also about what had happened right now in this post-pandemic and some of the concepts then, according to McKinsey, and also what we have contributed then in the pharmacy education in San Pedro College and in the Philippines, and also some of the development then in terms of our virtual simulations and the techniques that we have in the Philippines and our direction in San Pedro College. So as we all know that we are in the verge of the VUCA world, which are actually unpredictable, and that can be spelled out as V as volatility or very volatile because things are getting changing ever now and then, even now, no? With the intermittent connections of our internet, and also unpredictable in terms of our laws, and also the way we are now, with whether it's asynchronous or synchronous in a manner, and a sudden, a very extreme rate of changes that we have. And W is all about uncertainties, wherein the information are unknown and sometimes unpredictable in nature. And we have C, which is very complex, wherein many different and connecting parts are having a lot of complexities along the process. And even also A, which is ambiguity, which are lack of clarity on certain events. And this is actually started since 2020 when we started with our implementation in the Philippines, according to the Commission on Higher Education in this time of uncertainties during the pandemic era that we have during COVID-19. So things are getting to become complex at the time, and we become more resilient as we move along to the post-pandemic that we have, bringing along still with this volatility, uncertainty, complexity, or even ambiguity at this time. So we'll be able to address and respond this kind of VUCA world that we have as we move along to the VUCA response, which is V, to become more visionary of this kind of uncertainties, complexities, or even unpredictability in this kind of VUCA world that we are here. As we all know, to become visionary in the changing times that we have, even in our pharmacy education, we'll be able to be adaptive, to become, to know this kind of unpredictability, especially in this time where in our curriculum may need to be adapted to asynchronous or blended, synchronous and asynchronous in terms of blended learning or high flex or high flexibility in terms of our curriculum as part of our teaching methodology of our students. At this time of pandemic, we'll be able to understand, we'll be able to become adaptive in this time. As we all know that we may have unfamiliar on how we'll be able to give, like, for example, our internship program to our community, hospital, or even our internship, even in a manufacturing setting. This may become unpredictable at this time, especially now that there are increasing trend of COVID-19 in the Philippines and beyond. We'll be able to be clear, the sense of clarity then of the multiple interdependencies amidst global interconnectedness. And the clarity must start from within us, all of us, lecturers, teachers, professors, and we become more adaptive in this time, and we be able to become clear of what are certain modalities that we be able to give to our students. Clarity in the sense that we be able to become creative, innovative in our pedagogy and our learning methodologies. So adaptability in the sense of trying to change the landscape of our curriculum then to become adaptive in the science of the time, meaning that what we have given in the pre-pandemic is not anymore adaptive in the sign of the post-pandemic. So changes must be implemented in all sets of our curriculum, whether it is curricular or extracurricular for our student, adapting with high flex, adapting virtual simulation to make it sure that our students will be able to be safe and effective in terms of their curricula activities. And of course, agility or agility will be looking into interpretations of scenarios and multiple perspectives that we have in this time of pandemic. Agility is looking more on openness to possible things of the new trends of pharmacy education that we have. We are looking at like micro credentials. We are looking at dual degree program in the sense of the distance learning or an online learning, that making it more seamless, borderless with one university to another, that making the world as our classroom, as part. It is not already our four corners of the room that we have, but then the world is our classroom. With these changes that we have, we'll be able to adopt, according to Professor Satar Bawani, that this is already a development not only about critical thinking, but moving forward to cognitive readiness. According to Professor Bawani, that this is all about preparedness of mental, emotional, and interpersonal relationship with students among all diverse populations. As we have heard in a previous speaker, diversity is the key right now in a multicultural, a multi-religious, and multi-diverse population looking at seamless and borderless learning into our pharmacy education. And moving forward to this competency of 21st century learning, adapting on metacognitive, communication, attentional control, and sense-making, wherein we'll be able to be responsive in this time of preparedness of our curriculum then. With this, we'll be able to leap up to this kind of vocal world, adapting the L, become liberal into openness of our behavior, our attitude then, and opinions and perspectives, and to adapt to this kind of times that we have, and become exuberant, wherein there is a sense of commitment, passion, and optimism to move forward in changing the landscape of our pharmacy education, then to become more creative and innovative and adaptive to every multicultural and diversity that we have, and become agile, no, in terms of become proficient of this kind of changes and really be adaptive in evolving with the science of the time of our different universities and colleges, to become adaptive in this cognitive readiness and creative thinking, adapting it into our methodology. And of course, lastly, to become more collaborative, bridging partnership. So meaning that if you are a university or a college or a student that wants to be alone, this is a time to really become more collaborative, more interactive, more on partnership with other institutions, because this is already the fad. This is already the trend in terms of intra and inter relationship between organizations, between universities, and also colleges. According to McKinsey, in the report on the Beyond Coronavirus, the Path to the Next Normal, we are in these 5 stages. Before, in the pre-pandemic, we tried to resolve this kind of adaptability, knowing what is going on in this time. And we are like moving forward on what would be the next, how can we resolve in this time of stage 1. Moving forward, we adapted to this kind of modalities. We adapted high flex, we adapted synchronous and asynchronous and blended learning. Some of us already returned then to our classes, having face-to-face, having also semi face-to-face, no, hybrid format. We're in our laboratories in the Philippines become face-to-face, because we know that laboratories in this time, students are really lacking in terms of the skills. So we'll be able to have this high flex with our students. And we be able to move on to this next stage. How? Why? And is it really become more creative, innovative in adapting virtual simulation, adapting also hybrid format with our students, and a lot of modalities that to be able to reimagine and testing the waters then of changing these modalities of our education in the pharmacy. Moving forward, we are in the verge of moving from stage number 4 to stage number 5, wherein there might be reform in modernizing this education that we have, moving forward of internationalizing with the intra and interrelationship and partnership with other universities and colleges of their best practices in the region. So with this, as part of our contribution, we'll be able to adopt this kind of collaborative online international learning with other universities abroad as part of our changing the landscape of our pharmacy education in the country, in the Philippines. And we started in San Pedro in providing with our students another learning experience of what we call as collaborative online international learning, wherein this really adopting on the ability to collaborate with peers, with students internationally. And we adopted these four major principles of dimensions of virtual mobility to our students and faculty, collaborating them with our teachers and also students with related projects. And of course, adopting online platform then, no, making sure that they be able to have a conversation, developing in terms of their 21st century skills of communication and of course relationship with the students abroad, and the potential of international dimensions of diversity, inclusion, and of course sustainability with the students, and integrating the learning matrix of elevating the curriculum to a higher standard with our students, with the curriculum here in the Philippines and also in other countries. These are the benefits that you can see. The COIL in other countries, also known as virtual exchange or globally networked learning, wherein they be able to become a preparation for the students to become globally competent students, equipping them to this 21st century of civic engagement in a global context. So what we actually do is collaborating them with other universities like San Pedro College, with other universities like Universitas Erlanga, and we actually incorporated them into what are the learning outcomes, the learning objectives of each and every curriculum then, and integrating them, the similarities and differences, including the language, the culture, economic, and other perspectives then relating to the practice in one country and another country. And these are integrated in the credit of each and every country relating to their curriculum. This is one example of our COI plan wherein we negotiate to other partners in relation to the activities that they have done and also the activities that we have done in the Philippines. So there might be engagement in a long duration of time, from 3 weeks to 5 weeks to even in a semester or even in a 1-year program that we have with other students. The first week that we have is more on icebreaker, wherein they learn to one another in terms of culture, the personal details, and others. And also in the following weeks, they'll be able to do projects by their own relating to project on, like, for example, in the pharmacy, pharmacokinetics, pharmacy counseling, patient counseling, and of course, other set of subjects that they have. And the last following week is more on presentation, the culmination of their project, wherein they be able to project their project in that time. So this is really relating on the development of our student, relating to the 21st century skills of critical thinking, wherein they be able to immerse on certain case studies and problem-based learning and project-based learning, wherein they be able to develop their communication, leadership, response, collaboration, and others, which relate to have this 21st century to be able to have a graduate that adopted to become future ready. So these are some of the examples that we have. Like we have collaboration with University Kebangsaan Malaysia on pharmacokinetics and medication review, wherein this is negotiation with their dean, Professor Makmor Bakri, and other professor, Prof. Ernida and Prof. Adyani, wherein we try to negotiate on what are the learning outcomes and the projects that we have with University Kebangsaan Manila. We have already two projects with them from 2020, 2021 to 2022, and moving forward for another project which really relate on Sustainable Development Goal number 3 on good health and well-being, and also with our Sustainable Development Goal number 17 on partnership with goals. Another project which developed interprofessional education with the Faculty of Medicine, with Jember University in Indonesia, with San Pedro College, relating on case studies on antibiotics and antimicrobial stewardship at that time. So we actually put it in our immersive class to class. This is our collaborative platform, an online platform wherein we integrated with Padlet. You can see their personal, shall we say, informations are there with our students, and also relating on the video output on certain case study at that time. These are some of the case study with University Kebangsaan Malaysia, also relating to our case studies. We have also have our collaboration with University Brunei Darussalam, and also with other universities such as in the Philippines, Centro Escolar University, we have Lorma University, we have also the St. Louis University also, relating to our project with COIL My Dispense, using the virtual simulation with the university in Monash University, Australia, in the Faculty of Pharmacy and Pharmaceutical Sciences, wherein we have case studies in the My Dispense on the dispensing process with our collaborator with the University Brunei Darussalam. So these are some of the projects that we have relating to the multicultural uh, case studies with a Muslim population, wherein they have counseling with during Ramadan with one of the case here, and also relating to the case of over the counter, and also pregnant women and other cases on infectious diseases. In the Philippines, in San Pedro College, we are the first and the top coiler in the Philippines, which have 42 coils, and we have engaged more than 1,270 students and 795 foreign counterparts. And we have launched our global classroom wherein the faculty from other countries immerse to our students relating to class and also other extracurricular activities using webinars and others. It can be done also in a multilateral wherein they have 3 to 5 partners at the same time. So this is one of our partner from Brazil, South Africa, Ireland, and Mexico, wherein they have multicultural engagement with our nursing program. So it's not only pharmacy, but we have also integrated with other programs that we have. And we are using with our online platform. This is our collaborative platform using Immerse You Class to Class, wherein we put all of our collaborations here and also other format. We have also our IPE partners here, and we have conducted studies here wherein some of our students in one of our semester really appreciate in terms of conducting with a collaborative online in developing them in terms of intercultural communication skills, broadening in terms of their discipline, and of course, developing in terms of their problem solving, global citizenship, in terms of critical thinking, communication, and of course, their leadership skills. That is in line with their 21st century skills. According to our qualitative study, they really improve of themselves, not to become more global citizen, relating in terms of their communication, intercultural, of unique traits of other individuals, not only looking at in terms of differences, but also similarities with other countries and in their pharmacy education. One of the barriers that we have in terms of the coil is also in terms of the time, the language, and of course, internet connection. But it doesn't stop our student to really collaborate with their peers, but it becomes a challenge. And that challenge, they really resolve it. And of course, it's more on designing, building infrastructure of information technology, and of course, assessing our student using rubrics and other modalities of evaluation, and of course, collaborating it. In our direction, we'll be able to more Philippinize, collaborating with our Philippine partners, become more flexible, and adopting micro-credentials and global digital badges to our students. And of course, strengthening more on ASEAN and Asian counterparts in terms of our COIL and forging more relationship in terms of our COIL My Dispense in the Philippines. And if you are ready to collaborate, we are also ready here in San Pedro College and our schools in the Philippines, headed by our Philippine Association of Colleges of Pharmacy in the Philippines. So we're very open in the collaboration with our ASEAN and Asian counterparts with our virtual simulation, the My Dispense, and also our collaborative online international learning or virtual exchange with you. If you are ready, you can contact us. And thank you very much to UNAIR, Universitas Erlanga, and to the universities who are here, and to San Pedro College and PACOF for this opportunity. Thank you very much.
Thank you very much, Dr. Faller, for the very informative presentation, and also the many collaboration that have been made in online learning is very interesting. Would you please stay with us for the discussion session after the third presentation? So, and also a reminder for all participants, you can write your question in the chat box. Thank you. So our last speaker is Madam Shiren Binti Alwi from Faculty of Pharmacy, University Malaya, Malaysia, who will present post-COVID-19 pandemic pharmacy education in Malaysia. Hello, Madam Shiren. Assalamualaikum.
Waalaikumsalam warahmatullah. Hello, everybody.
Hi. So I would like to introduce Madam Shiren. She has a Master Clinical Pharmacy from University Science Malaysia and her Bachelor of Science Honours from Liverpool John Moores University, UK. And her current position is Assistant Coordinator for the Library Faculty of Pharmacy, University Malaya. Malaysia Alumni Coordinator, Faculty of Pharmacy, University Malaya. And she's also on the committee of Malaysian Pharmacy Society Strategy and Planning Committee. Also the Secretary of Malaysian Academy of Pharmacy and member of Malaysian Pharmaceutical Society, and also she's the auditor of Malaysian Qualification Agency or Pharmacy Board Malaysia. Her research interests including clinical pharmacy, pharmaceutical care practices, quality of prescribing, and pharmacy education. Madam Shirin, you have 20 minutes to present your topic, and the time is yours.
Thank you, Dr. Yunita. Hold on now, I'll share my screen. Can everybody see it?
Yes, we can see it.
Okay. First of all, thank you, University of Erlanga, for having me here, for inviting me to talk to everybody and share my experiences, what we have done pre, during, and post, and what are the challenges that we're going to go forward for this after this COVID-19 pandemic. Also, thank you everybody here for coming and listening on a Saturday morning. Okay, I'm sure it's usually a weekend day that you like to rest, but congratulations, you're here and to listen to us. Okay, so for today, for this more or less 15 or 20 minutes talk. What I will cover that what we have done before pandemic, during pandemic, and post pandemic in terms of teaching and learning activities. And also we're going to look at how, what is a way forward and what are the challenges and strategies to overcome the challenges. So before the pandemic, okay, we were not expected to be on total lockdown, right, everybody? So we did not expect to be on total lockdown. We did not expect to have a worldwide um, virulent coronavirus going around, and travel ban restrictions here and there. So it was like the first speaker, Dr. Schneider, mentioned that it was a destructive transformation, but it leads to a better outcome. Okay, so in terms of teaching and learning in the pharmacy schools, what we did was we still have face-to-face teaching. We still have, this is um, where the students comes in for role play sessions, and the pictures on the top, both top, is basically the students goes for their hospital attachment with the pharmacists. They are at the dispensing counter talking to patients, and the top right is basically filling in the prescription, exercises, and the right bottom is basically the community outreach program for the soft skill development. So the students go out to the community, talk to them, counsel them about medication, about diseases, about healthcare promotions, and all that. And then this is in this picture, what the students do is basically a basic screening. Okay, so pre-pandemic, before pandemic, so students are able to do all those things. So during the pandemic, so once the pandemic, once coronavirus comes in, there's all this lockdown, there's all this travel bans, travel restriction. You cannot even go to the next city, things like that. Students cannot come into the campus. So what we did was, I'm sure it's the same sort of with anybody throughout the world too. We reverted to online classes, whether it's pre-recorded, asynchronous, or face-to-face synchronous virtual online classes. Um, in terms of practical, we um, video. Okay, so the lab technicians have to videotape the practicals and show the students how is it done and things like that, and give them a simulated data for them to write up the practicals and analyze the data. We, well, at the same time, we use whatever the online platform, the websites, okay, for sharing of information, lecture notes, give them exercises to do what they, from before they come to class for the online class or face-to-face class. We also utilizes My Dispense, which is basically a virtual pharmacy stimulation. So during the lockdown, the students are not able to go to the hospital attachment to the hospital, any community attachment, or even industrial attachment. So My Dispense is a way of giving them this exposure, at least a little bit exposure rather than they don't have exposure at all. Okay. So most of the time we do this, My Dispense, for our OSFI or OSP. At the same time, also, it's not only a teaching and learning for soft skill developments, for organizing, so students to organize activities and all that. They use, have to do it online. This is what I call it, a white coat ceremony, where the first year comes in and have their pledge to become a pharmacy students, and they go online gathering. Okay, they have all the performances, what the students do, and all those. In terms of community outreach program or social engagement program, it's good for the students for their social, for the soft skill development. Since it's not face-to-face physical, so we have to go for online too. So what the students did is basically have a video on book reading for the children. Okay, so this we have what we have done during the pandemic. So after that, what happened is the travel lift ban. There's no restriction. There's a little bit the students can come back to campus, but with some of short standard operating procedures and all those. So they can come to the campus, but they, because of the numbers, the total class numbers are not able to fit into one whole class in the whole lecture theatre. So we have to divide into group A and group B. So what we did was we have a hybrid teaching, which means half the class will be online. This is what the picture on the bottom right. Okay. So half the class will be online and half the class will be on site. So there will be cameras, a virtual um, pictures of us, and also sharing of slides with both online and on-site students. You can see they have to have come with facial mask, and they have to follow the SOPs with together with the um, hand washing and all those things. Then the picture on the top is basically, this is the students coming in for OSCE. So they have their individual room for OSCE, and the students also are able to go for hospital attachment during the endemic time. Okay, after when the number of cases is a bit low. So, but you can see the students going with facial mask. Yeah, facial mask together with face shield. Okay, so um, where are we now? Okay, so what are the changes and where are we now? So how are we going forward? So now we are not going back to more just a physical face-to-face lectures and tutorials only. So the way forward is basically a blended learning. Okay, like the previous speakers, the previous two speakers mentioned that um, with students need to be more technology savvy. Students needs to be more with know of the automations, okay, mix around with international students, not just with your own class and your own student, your own faculties and things like that. So the way forward is basically a blended learning. So blended learning is basically a mixture of both physical and online learning. Okay, so to go for blended learning is basically we have to have a what they call it a digital transformation. That's what we basically it has already be there. It's just that because of the pandemic, it hastened the process. Okay, so digital transformation, expansion of distance education, like Dr. Edwin mentioned just now, we have internet. They have international collaborations and things like that. So we just finished also our certificate program for pharmacotherapy of geriatric population yesterday. Okay, our last class was yesterday. So it's also international. So we have international participants inside the program. Uh, Online classes, interactive, face-to-face synchronous, the users also users of teaching aids such as electronic whiteboards, live polls. Like we have online rooms, breakout rooms, and things like that. Being a blended learning, we have to have a variety of teaching and learning and assessment methods. It's not just at the end of the semester you have to go to the exam hall and write a 2 hour paper or 3 hour paper written examination. So it's more towards whether you have alternative assessment methods. For example, that if you can use even a my dispense to have a for a summative, also for a formative assessment. Okay, or you can use as simple as Kahoot for a formative assessment. Okay, um, to replace. So the alternative assessment is to replace the final written examination. More towards to develop students not just to come in into a written, but to be able to have other skills such as communication, presentation skill, oral presentation skills in front of the school class or in the lecture datas, and then practical session hands-on, okay, recorded lectures, or whether it's synchronous or it's asynchronous. And then we also, the variety of teaching and learning methods and assessment methods is also, if um, usually if it's for skills, competency skills, practicals, it's still best for the students to come in. So what happened during the pandemic is that when the students are not able to come in, when the travel ban has been lifted, the students comes in and not considered as a redo, but they have additional physical lab sessions, okay, to build up their practical skills and things like that, so that when they go out and when they graduate, at least they have the skill that's needed at the end of the day. So whatever that we do is basically based on our standard of pharmacy program accreditation. So in Malaysia, we have the standard of pharmacy program accreditation, which states that at the end of the day, at the end of the 4-year program, the students have to be able to do this, and this. So whether pandemic or no pandemic, whether post-pandemic or pre-pandemic, whatever the outcome, okay, the what they call it, the program outcome has to be achieved. So the role of the teachers here, the role of the lecturers here, is to make sure that the outcomes are achieved. Okay, regardless of how we deliver the material in terms of what are the teaching techniques, whether it's online, whether it's virtual, whether it's live streaming, things like that. Okay, the same. That is why also at the same time, even though we'll see that community outreach program, it's uh, you have to go to the community physical and have a look and talk to the patients and things like that. But when with the during the pandemic, we're not able to do that. But still, we have to carry out some community engagement projects. So that's why the students go for the online projects. Okay, um, so that the students will not be deficient in that particular area, in the soft skill area. Okay. So now we are going towards the technology, the hybrid kind of teaching, the blended line of teaching. We are going for the IR we are going for the AI. Okay, we are using all sorts of program. We are going more. We have to get our students to be globally competence in terms of global standard. Okay, so where do we go that, and how do we do that? What are the challenges and the strategies to overcome that? Okay, one of the most important thing is basically um, inequality in terms of digital divide. So basically, some students are not um, able, cannot afford a computer. Okay, cannot afford internet packages. We have students that have to go to internet cafe during the lockdown nearest to the house to sit for exams. Okay, um, previous another universities has in the very rural area in Sabah, the students even have to climb up trees to make a tree house for her to sit an exam during to get internet connection to sit for the exam. Okay, so that it was in Sabah. Sabah is very in the rural area. So if we can address it, because this is not something that everything is going to be back to physical face to face, and it's not going back to the traditional. It's going to go forward. Okay, so students needs to have at least the digital um, I mean, at least to have the computer or handphone and internet connections and things like that. So if the universities or the government can provide portable computer packages or internet packages for students, and if the students are not able to, the house is not a conducive environment to live, to study, then maybe university have to provide hostels and for the students to come in and study in a hostel. Okay, ICT, further investment in ICT's infrastructure. Maybe now DG4 is not advisable. You may need to go for 6.0, okay, because of the increase on usage, okay. At the same time, also, this is I think it's worldwide too, because one of the studies by Dr. Majid from KSU, one the students in his studies, some of the students mentioned that they are well with the teaching aid that the teachers are using, but the teachers are not well with the teaching aids. Okay, so that's one of the things that also we as teachers also, or we as lecturers also, we need to get ourselves um, up, basically upgraded, updated with all the teaching aids and things like that. Okay, through courses, or we can have an ICT help desk, which is all of them. Um, Even though there is no um, not a pandemic, there's no curfew, there's no travel bans, there's no restrictions, there's no lockdown at the moment, but it's still in an endemic situation where the patient, we still, the virus is still there, still mutating. Everybody will get it sooner. Still infectious, even though, but with the viral, with the vaccines, whoever have the vaccines, the severity will be reduced. Whatever it is, we still have to adhere to the SOP, to the standard operating procedures. So let's say, for example, if we have a class in the lab, so not with the social physical distancing, we might have to break the class into half, and one class will go to one lab A, and another class will go to lab B, things like that. Um, Mask at all times if it's in a closed room, okay. Um, Hygiene, wash hand, and things like that, still all the same. So it's not something that it will go away. It is a new normal now. We still have to do it. Okay. So all those things, all those whatever that we are going to do is going to not only make our students um, be aware or adaptive to the situations that we are having at the moment. Okay. um, we are also making them at par, at least not lacking because of the pandemic, and then they are not being able to be exposed to what experiential learning they are supposed to be doing. Okay. Um, yeah. So I'll share. I think I have. And now I'll share the rest during the Q&A session forum later on. So, okay, to summarize, blended learning is a way forward with all the ITs, with all the digital transformations, with learning aids and all that. To do that, we have to have an up-to-date IT facilities for students in class, or I mean in hostel, or even at their own house and things. For example, if they are learning
Cek.
at home, and to get support for students in need in terms of computers, in terms of iPad, in terms of internet packages if they need to facilitate learning. Okay, so thank you so much. That's my last slide. I'll end it now. I'll take any questions later on during the forum sessions later on. Thank you. And this is University Malaya, which is in the heart of Kuala Lumpur, and this is our faculty. Thank you so much.
Thank you very much, Madam Shirin, for the very informative presentation. We have three very interesting presentations from our three speakers addressing the disruption and the changing of pharmacy education. And as we know, COVID-19 pandemic certainly become one of the force behind many transformation in pharmacy education. We have experienced so much during the pandemic, hence and have seen many innovation and creativity to adapt to the current situation and transforming our pharmacy education. Dr. Snyder mentioned about the creative mind and all other aspects that we need to incorporate in the development of pharmacy curriculum. Dr. Fuller shared the many virtual action that he has made in transforming pharmacy education, and Madam Shiren also shared the Malaysian pharmacy education experience post COVID-19. We learned so much during the short course of 1 hour. Now we will have the discussion session for another 1 hour. Participants can write the question for our three speakers in the chat box. And I see there are already some questions. I will read the question one by one in no particular order. We have question from Dr. Andi Hermansyah. Dr. Andi Hermansyah asked question to Dr. Snyder and Madam Shirin. Thanks Dr. Carl and Dr. Sharin. That was an astonishing presentation. I still remember when my dispensing practice software was introduced back in 2014. The software became a buzzword within the region, and more importantly, it contributes to a more digitalized approach in pharmacy education. So nevertheless, my dispense, like other e-learning approach, would contribute to a social isolation and virtual simulation based study rather than actual case learning. This may affect the personal interaction and self-motivation to treat patients, which are the core of the pharmacist profession. How would you view such disruption affecting skill development of students and the lectures? Thank you. Maybe we can start with Dr. Carr first.
I'd like to thank Dr. Havansia for that question. And it's a challenge that we faced at the University of Sydney. We decided to operate a blended approach and had my dispense for practice reinforcement. However, we were also concerned about the limitation of the current technology for delivery of communication signals for pharmacy students. As we know, communication is not just verbal, it is also paraverbal in terms of intonation and also non-verbal. The predominant amount of communication in a patient consultation is actually non-verbal cues. We pick up these subconsciously, and this is something that we have yet to be able to mimic in a virtual environment to a large extent. This is changing. It is evolving, but we are not there yet. The pandemic was so disruptive, it brought things forward, but we have not got a replacement. So if we look at the domains of learning, if we use Bloom's, I think the affective domain is limited with the current modality of virtual technology to teach pharmaceutical care. So I would use it in a blended approach and reinforce it with face-to-face role play, simulated patient, standardized patient, and indeed workplace-based assessment.
Thank you, Dr. Snyder. Maybe Madam Shirin can continue.
Yes, we do the same thing also what Dr. Snyder did. Basically, for the practice sessions, they use the My Dispense. Then after that, they will have 1 or 2 sessions face-to-face physically with the assessors, with the patient. Then only that assessment in the ward or in the community pharmacy. The same thing also. It's not just basically solely on My Dispense. My Dispense is used as a practice session for the students, because you can't get patients to talk to the students for 3 or 4 sessions, for practice sessions. Yeah.
Thank you. So basically, you mix My Dispense and the real interaction with either the real patient or maybe a simulated patient as a role play, or maybe the real one. Okay, thank you. So I think we have the same problem here in Indonesia, even though we did not use the My Dispense, because My Dispense is in English, and most of our students don't really speak English in daily life. So, but we do. use the role playing and the simulation, and also a patient simulated to assess the student ability. Okay, thank you. Can we move to the next question? This is for Dr. Feller from Grace. She is interested in the COIL program. How can I join that kind of activities? Are there any credit points in the COIL program? Dr. Feller, are you available? Okay, maybe we can postpone the question for later. We have another question for all the speakers from Putri. I'm a lecturer from Faculty of Pharmacy, Universitas. Oh, you're here now. So, can you hear my question, Dr. Feller, about the COIL program that Grace asked you?
Yes. Yes, I think I would like to answer first the first question about the My Dispense. We are using here in San Pedro College since 2019 during the spark of the the pandemic. The pandemic. It really urged us really to use the My Dispense because at the first place we don't have a choice, no, because in the community setting, it's really they don't want to accept interns, they don't want to accept in terms of collaboration with the community or even in the hospital setting. And we saw in one of the webinar with regards to the My Dispense, it really we immediately adopted here in San Pedro College with their license URL that we have here in SPC. Moreover to that, in answering with the question, is it really affecting with the skill of the student? According to what we have conducted in terms of a research, and that is published already in one of the reputable international journals with regards to the My Dispense here in the Philippines, it does not really affect in terms of the skills of the student. Well, in fact, it really substantiate with the skill that they have in terms of dispensing because it really have this kind of a virtual simulation. It really can repeat every now and then with the dispensing skills of the students relating to different prescriptions. In terms of perspective, confidence of the student, it really increases according to our study. You can read that one online in terms of one of our research in the My Dispense. It has significant relationship then with regards to how many times that they be able to use what with the My Dispense, with the different prescriptions, and how many prescriptions that they have. It really relate. The more that they be able to use with the My Dispense, with the different case studies, with the different prescriptions that they have, they really hone in terms of their skill. Yes, it may not be similar with the skill that they have when they have their face-to-face engagement in the community setting or in the hospital setting, but at least it's substantiate virtually then in terms of the skill that they have, which are lacking in this time of the pandemic. So it really helped us a lot in San Pedro College with the use of the My Dispense according to our different researches, qualitatively and quantitatively at that time. With regards to the coil, I think I was in another another setting, another webinar that I have giving an open speech. But then relating to the coil, I think this really improved in terms of the skill, the 21st century skills of our students relating to other universities, connecting with them, like for example, our students relating with University Brunei Darussalam. As we all know, it's really have a lot of Muslim population. So with our students here in the Philippines, our students in the Philippines, according to our research conducted during the time, that it really have a significant increase in terms of their intercultural engagement with the students. Especially there are cases relating to like Ramadan time, relating to fasting, relating also to how they be able to deal with like social history in terms of alcoholism, smoking, because that is sometimes very controversial, especially in countries wherein there's a lot of Muslim population. In terms of that really relate here also in the Philippines how sensitive it is when you try to have other population, indigenous people, Muslim population here in the Philippines, and also Christian population here, relating to race, relating to gender, and other related factors. So yeah, that really give us more insights than not only culturally but also skills of communication with our students.
Thank you, Dr. Feller. Grace want to join COIL and she want to know whether there's any credit point for the COIL program.
As of the moment, when we collaborate with our peers, no, because of like for example, a lot of legal matters, like for example, from your country, your pharmacy board, and also our pharmacy board here are quite very different in terms of legislation and all. As of the moment, we try to integrate with the COIL relating to us here. We have actually our credit also, you have also another credit also in there. So meaning that as of the moment, we try to have those who are enrolled in your subjects in the pharmacy curriculum and also those who are enrolled in our subject. And both of the subject will be able to adopt in terms of similarities of learning outcomes and learning objectives. And then they be able to do some projects relating in the outcome-based education of both countries relating to the work. Like, for example, we have here on subject on dispensing, relating to University Kabangsaan with regards to medication review, because that is one of the topic in our dispensing class. So we integrate it in our classes with relating to topics, projects relating to medication review. We have a case relating to medication review, and the students will be able to engage with simulated patient or maybe the case relating to like infectious disease or relating to pediatric patient or geriatric patient in that manner. So it's not only about the topics about geriatric, pediatric patients that they have learned, but then in terms of communication, intercultural, leadership, no, and of course other patient details that they be able to learn. So that is very important to us, no? The diversity, intercultural, and etc.
Thank you. So we have another question. Moving to the next question for Madam Shiren. This is no name, but he or she asks, based on your explanation, the learning system carried out in Malaysia are divided in several strategies, namely physical session and online class. How do you manage the courses? Which need physical session or offline class and which can be conducted online? Thank you. Which one is online and which one is offline?
Okay, for our semester system, we have about 14 weeks in a semester. So if you have a 3 credits module or course, that means basically you have about 3 hours per semester per year week. So what we do, like say for example, so if we have, let's say in that 3 credit module, we have maybe 12 topics, okay, around maybe 12 topics. Each topic is 2 hours. Then out of the 12 topics, most of the time, the one in the beginning, the one in the middle, and the one at the end is physical. So we see the students first in the first few weeks for physical. Then after that, they can go for online classes. Then in the middle, before they go off for the semesters or when they come back from the semester break, they will have physical. Then after that, will be still online, and then after that, at the end of the semester, then we'll have physical back. So most of the time is something like that lectures. But if you can have tutorials, if you think that that particular topic is quite a tough topic, you prefer it to be a live face to face physical, then you can put it as face to face physical. um, it all depends on what is the also because we have a guideline saying that um, in terms of blended you have to have 30/70 or 40/60. That means 40% physical, 60% online, or in terms of if you have extemporaneous module, it cannot have 60% online. So most of the time, this extemporaneous module, it will have at least 70%, 80% physical. So it varies depending on the depending on the module, depending on the course learning outcome and things like that. And then depending on the difficulty of the topics, if you need it to be online, if you need to be a physical, then easier for them to ask the questions. I mean, students to ask you questions and things like that. It's not, then you have to make it physical.
How about the laboratory practice, the practicum, the lab?
Okay.
Did you have it
You,
hybrid also?
okay. During the pandemic, where all the lockdown and everything, all online videos. Okay, we give them videos, we give them stimulated data, then they write up the case reports based on the stimulated data. Now, for practicals, because we are measuring their skills, their psychomotor skills, they have to come back physically. They can have the video as part of just a preview and what they want to what we can say they know they do what, and then when they come to the lab they have to do it themselves with using their hands, basically do it um, yeah, they have to do hands on lah. No nowadays lah, because being a
Because of
pharmacy
the
accessible, sorry,
situation, because of the current situation, so it's already possible.
yeah, now because of the current situation you can't have extemporaneous online, is it?
Yeah. Yeah.
Okay.
Okay. Thank you, Madam Shirin. I have one question for the three speakers. What about the learning outcome? I mean, do you see any loss? I mean, during the pandemic, like the almost 2 more years, we have so much online learning. We have student learning from the video. We have so many simulation, and now some of them already graduated or almost graduated. Do you have problem with the outcome, with the learning outcome? Do we have lost skill or something? Can you maybe start from Dr. Snyder? Thank you.
Yes, in short, there is obviously disruption can cause disruption to established practice and including instructional design. I mentioned Bloom's earlier. If we separate learning domains into psychomotor, cognitive, and affective, we see the difference in how we can provide learning, instructional design virtually. Psychomotor is very challenging. This is the area that was mentioned that is very difficult to deliver online. It's like learning to drive. It's just because I can get a high score on the driving simulator doesn't make me an expert driver in real life. Similarly, cognitive, this is able to be delivered virtually. Cognitive is primarily knowledge, and that can be delivered virtually. Affective, as I mentioned earlier, affective in terms of communication, this one is partially able to be delivered online, but not completely because of a difference in the mode of communication There's a difference in delivery. This we see in healthcare delivery, telemedicine versus face-to-face.
Thank you. Maybe Dr. Feller can continue also.
Yes, I think inevitably there might be some disruptions here in the Philippines with regards to the skills of the student. But nevertheless, I think the responsibility is actually to all of us, to really mobilize in addressing to that kind of gaps in the Philippines. So what we do actually, we try to have this in every year levels that we have this competency enhancement for our students to really cope up of what we have lost in terms of the skills and moving forward to the hybrid programs wherein all of our lectures, if that will be not be necessary to have face to face because of the increasing COVID here in the Philippines, we may actually have our laboratory to be face to face because we want actually to cope up in terms of the skill. We may say that some students don't know what is all about some laboratory equipments or even flasks or even test tubes, no? But that may be funny, but it may be true, no, to some or to some of the courses also that had been provided. But then, nevertheless, we'll be able to be patient with our student because the disruption really puts into the context to test in terms of their knowledge, their skills, and as a lecturer, there must be more patience, enhancement to our student in this time. So they be able before they be able to start, will be able to go back then to the basic principles of laboratory, basic principles, but there must be a really kind of um, kind of enhancement also in the lecture wherein this virtual simulation really help to really enhance because you cannot just do it in 3 hours of time enhancing them and going back again here and there, so meaning it really help still with the virtual simulations that we have, so combining virtual simulations and face-to-face really can really enhance them, but we be able to back up that with our related studies then or researches then with regards to this matter. So really, there's really a vast water in an ocean to really test on effectivity right now with regards to our enhancement, our the disruptions that we have. To what extent is a disruption happen here in the Philippines and also beyond? So this is has a lot of things to do with regards to this matter.
Thank you, Dr. Feller. Madam Shirin, please.
Um, I'm sure. I mean, I'm sure everywhere, pharmacy program is being controlled by the professional board. Okay. So the professional board has their own standard. At the end of the program, at the end of this 4-year program, the student should be able to do this. So as I mentioned earlier, regardless pandemic or no pandemic, the students must have be able to do this, right? So we teachers have to creative how to deliver that and how to assess that. So at the end of the day, the minimum, at least the students would be able to do that. But if they have the physical lab sessions, for example, if they have the physical contact with patients, talk to patients, go to the ward and things like that, then the competency or the experiential learning is more compared to the one that is being on to just to do during the pandemic. Okay. So that's the role of the teachers. They have to make sure that these students, regardless whether it's pandemic or no pandemic, they would have the minimum competency, or else they would be called pharmacists. You see?
Yeah.
Could
Okay.
I could I just add one more thing, please?
Yes,
Sure,
please.
sure.
We talked about deficiencies. I would also like to talk about benefits. And we have seen a step change in Sydney, and I think in other institutions in other countries, in the contribution of pharmacy students to the workplace. Traditionally, workplace experiential learning has been more observational, studied observation, and through the process of entrustment over time, they start becoming part of the workflow, work integrated. However, in other professions, I'm a nurse and a pharmacist. When I did my nursing education, in first semester, first year, I was already helping as a nursing student in work integrated learning. This is not the case in pharmacy students. This only happens towards the end of their degrees. But COVID changed how this happened. So in second year in Sydney, we trained all our students to draw up vaccines. They were then deployed to vaccine hubs and they were drawing up vaccines because we did not have enough pharmacists to deliver the vaccine administration at the numbers they needed. So we were seeing pharmacy students actually performing work. This is a very big change in education and professional culture for pharmacy. The question is, how do we take this change and deliver it for the rest of experiential education for pharmacy students? Are we able to now take this forward and bring pharmacy students more into the work integrated learning culture?
Yeah, thank you. That's uh, very good things to do for the students, and it's a very big responsibility also. And also, how about the legal aspect? Is it okay for the student to do that?
They were empowered.
Oh, okay.
They felt valued,
Yeah,
contributing to society, and able to show that their technical skill in being able to do this.
so good to hear that. Thank you. So we move to the next question. We have question for all speakers from Putri. I'm a lecturer from Faculty of Pharmacy, Universitas Airlangga. After the COVID-19 spread has been under control in Indonesia, our university decided to open the campus for face-to-face lecture or offline class this semester. Would like to know if this situation also happened in your university, and what is the biggest challenge to do, and what strategies have been applied to encounter the challenge. Maybe Dr. Snyder also want to address this first.
Uh, I think this is something that is common to all, and I think it is something that we know as educators. The challenges are uh, multifactorial. The challenges lie in the resources, the structure, and being able to part of the problem was a lack of knowledge. At the start of the pandemic, we did not know. Only very few people knew that it was distributed via aerosols. So this created a problem in itself because there was transmission because people were not wearing masks. Now that persisted for almost 12 months. And depending on the country, there was rapid transmission. So knowledge was a problem. And then there was a lag. We always know there's a lag between evidence and implementation. So we had a situation where we have evidence of masks. We know that we should be wearing masks. Yet, even now in Australia, I'll be honest, at Sydney, we still have the logic of aerosolized transmission. We haven't moved this forward to CO2 monitoring, to air filtration, UV filtration, air exchange rates. All of this actually, as pharmacists, we know this as part of manufacturing. But this has not been transmitted through building design. This will take longer. So these are the remaining challenges if we are going to have an endemic situation that or future aerosolized pandemics. We need to change our built environment that will allow us to practice in an educate face to face.
Sorry, Dr. Erwin, maybe you want to continue?
Yes, as what mentioned by Dr. Carl, it's very universal. But for us here in the Philippines, in our institution, San Pedro College, we are used to it already, no, of the calamities that we have before the pandemic. There's a lot of disruptions already of the classes because at the time it was actually an earthquake, no, experience in the Philippines, and it really disrupt, for 1 week, 2 weeks of classes that we have. So the good thing is that we have already installed and invested a lot of the information technology in the campus, building learning management system already, connecting with our students because some of our students are located in a very, far-flung areas wherein they may have intermittent or even none of the internet connection. So these are major hurdles for all of us because in the Philippines we are um, quite a little bit slow in terms of our internet connections here. But nevertheless, with the disruptions that we have and going to the pandemic in March 2020 as declared by our Commission on Higher Education to really stop in terms of face-to-face classes and moving on to an online format. Yeah, it has also a kind of twist in terms of our faculty to become more creative, innovative in the sense of fulfilling the learning outcomes of our pharmacy education to the extent that they may have a lot of best practices, like for example, really moving forwards more on compassionate to our students. Sometimes they lend their laptops, they acquire in terms of facilities, in terms of the internet load for our students and all. It becomes tighten a stronger relationship with our students also because where can they actually get this kind of empathy, of course, to their lecturers, to their teachers at the time. So it really become have higher have this kind of strong relationship with the teachers and all. Looking at the facilities and all, it becomes more adaptive with our universities here in the Philippines, building their learning management system to really contact and having all these platforms or modalities using Google or even Zoom platforms and moving beyond of this with our different association, sharing best practices at this time with other universities and colleges. So uh, it becomes more solid to all of us in the pharmacy education in the Philippines, thanks that we have a lot of association headed by our Philippine Association of Colleges of Pharmacy that to be able to relate to one another on best practices on how do we deal with laboratory, with relating also with our pharmacy board on how we'll be able to deal with internship programs that we have in the Philippines, whether it can be done through a virtual platform and also with now with a face to face, and some of it will be half will be dealing with lecture at the time and then dealing also vis-a-vis with another one with our face-to-face engagement in a community or hospital or manufacturing setting. So, meaning that we become more resilient and adaptive at this time during the pandemic. So, there's a lot of lessons that we have in the Philippines that we can relate with in this time. But we become more stronger, we become adaptive, and we become more informative at this time of pandemic.
Thank you. Maybe Madam Shirin also want to add something?
Um, when you have everybody one in 100 plus of you in one class, I'm sure there will be a chance of you getting infected somehow or other. So how
Yeah.
to we minimize that is basically this follow the standard operating procedures. Yeah, I'm sure each country would have their own SOPs. So if they say that you have to have a physical distancing of 1 meter within each other, or whether you're supposed to wear masks in a lecture theater closed area, then you have to do it. Um, what we experienced was when one of the students is infected from a colleague or from the family, they will infect the whole class. And we so happen at one time we have about 20% of our students down, infected and quarantined. Um, so when we have that, what we have to do is we have to revert back to online. All the classes, all the physical lab sessions has to be postponed and do all the online lectures and things like that first. Um, that is something that I mean, I'm sure at one point we'll have. And then also the faculty at one point, we have to close the faculty because the same thing, about 40%, 30% or 40% of us was infected. And they have to sterilize the faculty, all the offices, the equipments and things like that. Yeah, the virus will be there. I mean, in the next 10 years, whether we are immune to it, they will change. They will have different variants. Get vaccinated, inshallah, it will at least some point reduce the severity of whatever that if we get infected and follow SOPs. That's the best thing. Um, we cannot be fear of the virus, be it infectious, and do not get the students in class and get them all the competency or the skills that they needed. That's not something that we can compromise, because these students in later on they become pharmacists and they will be holding patients' health or patients' um, um, yeah, life in their hands, basically. Yeah. Thank you.
Thank you. Yes, I think we do have a protocol here in Universitas Airlangga, and we need to follow the protocol during the face-to-face classroom, and we are very excited to with what happened this semester, and the next semester will start Monday. So yay. This is a new semester and a new energy, and yeah, we will going to have a face-to-face activity again in the campus. So we move to the next question, also from Dr. Andi Hermansyah, directed to Dr. Erwin Feller. Uh, he said, thanks for the impressive presentation, and he agreed to the notion that COIL may facilitate the telecollaboration, and at the end of the day, it can increase the intercultural competence between the students. The issue, however, like any other inclusion program, COIL can be considered digital inclusion program if you like. Equity, including different intellectual, emotional, and socio-cultural positioning, may widen the gap if not properly maintained. This was occurred during the COIL program between US and Mexican students, which in contrast did not close the gap in terms of collaboration. How would you maintain the issue of equality in digital inclusion environment?
Yes, I think that is a very good question, and I think it matters then on the very first step, which is your design of your coil or the coil plan that you have, making sure that the inclusion, diversity, equity, and all those that is mandated in our global citizenship and sustainable development goals will be able to attain then, no? In relation to our learning outcomes. So in the process then of, like for example, groupings, making them together, group together, there should be a diversity also, no, of this of the participants that you have. So of course, with that inclusion, you must have also diversity in terms of gender, the race, and others that needs to be considered during your design of the program. Now, once you have the design of the program, of course, we should not actually let that no that someone will be left behind during the process, and that is a work then of the facilitators or the mentors along the process then of the design of our coil collaboration, making sure that everyone will be able to talk, everyone will be able to have their voice will be heard, and of course, they'll be able to have this kind of diversity along the process. And we'll be able to maintain that kind of diversity as we go along. We have a lot of experience relating to COIL, like collaborating with Japan, wherein some of their students are very shy because of some of them may not be speaking in English, but then we have a lot of ways how we'll be able to cope up with this kind of diversity, especially with language. Like we have also partners from Chile, wherein their lecturers actually interpret for them, you know, with regards to English to Chilean language that they have. So it's a matter of really going back to square one, which is really, are we ready in terms of collaborating? Are we ready in terms of diversity, inclusion, and equity as we go along to the process of collaboration? Of course, in the beginning, there might be a lot of adjustment, particularly with the negotiation between the lecturer or the professor, between one university to another. This will test in terms of relationship between university as you go along. So all of us lecturer will also be putting into this kind of intercultural diversity also and all. Uh, Not only with the students, but also with the lecturer as we go along. So meaning, as we go along to the process, we'll be able to know each other, not only in terms of very serious matter of our subjects, but also in terms of our personal, our likes and we don't likes. No? Like one of our collaborator, when we do the preliminaries or the prayer, as we call it, the prayer and the national anthem and all, one of the lecture mentioned, why is it that you're doing a prayer during your class? That was a collaboration with the US partner. We always say this is how we do it in the Philippines. We started with the prayer first. We start with the national anthem to recognize both country and all. And this is where the lecturers actually understand wherein there is really diversity among all partners and all. No? So and some other experiences that we have with regards to cultural, no, some sensitivity to race, to culture, to religion, and all. And this is a learning process. It's not actually it's actually it's like implemented it one at the no at the time instantly and all. It is actually a learning process wherein you'll be able to learn from one another of the culture and all. And that is part of the point. Adjustment is part of it. That's normal as we go. And that is where we need to be able to test it. We need to have a backup researches on it as the pre and the post of it so that to be able to really test our student of this kind of assessment evaluation as we go along in collaboration with our student. And we learn from our experiences as we go along to the process of this adjustment of diversity, the cultures, the race, and economic status of every country that we have. I hope I answer your question with that. But that's
Yeah,
really a learning process to all of us.
Yes, and he adds something. Dr. Hermansyah also said that we do need to test the effectiveness of COIL program this semester between SBC and the Universitas Airlangga students. Okay, so I guess that was the last question for the discussion session. Thank you for
Sorry,
yep, yes,
could
please.
I answer Fatih's question, if I may?
Oh, sorry, I think I missed one, is it? Yep, the artificial intelligence.
Yes.
Oh, okay, yes, please, Dr. Snyder.
Okay, so the question is whether artificial intelligence will take over the role or replace the role of the lecturer. I would say the role of the lecturer has already changed. The age of the sage on the stage is no longer. We have too much information that is available by other means, Google, online, that the the primary source of knowledge is no longer the lecturer. So the role has changed. What next? We need to move from being a content provider, a knowledge provider, to a knowledge guide. So we should be taking on the role of the coach. We may no longer be the role model. We will coach them and help them, guide them through the acquisition of skills and knowledge. To facilitate that, we need technological enhancement. So an excellent model would be the TPACK model, TPACK, which stands for technological and pedagogical content knowledge. So we don't just need to have content knowledge, we need to have pedagogical knowledge, education, but also technological knowledge. We need to understand technology, and we've been upskilled very rapidly to do this. I would also encourage you to look at open learner modeling. The idea that every learner will get feedback via AI on their acquisition of knowledge, and we will be there as a coach and monitor via dashboards that acquisition of knowledge via this open learner modeling. So I think we will not be removed, we will not be replaced. Lecturers are there, but their role will be different.
So we would not be replaced, but our role will be different, is it? Yeah. This question also directed to Madam Shirin. Madam Shirin, do you want to add anything?
Yeah, I agree with Dr. Snyder. We are no longer the source of information. Dr. Google is now. So we need to basically I agree with Dr. Snyder. We guide them. Okay, what kind of information that you look at, and whether it's in the Google, whether it's reputable, whether it's a primary source, whether it's biased, things like that. The other thing is that lecturers too need to be at par with the students in terms of technology. Okay, not necessarily just in terms of programming, in terms of some engineering, especially if they are teaching civics or technology, a little bit of engineering knowledge, a little bit of if they are looking at chemistry, some modeling programs and things like that. If we want to incorporate, because we have to go to nowadays, the everyone is going for AI, everyone is going for the IR 4.0. So if lecturers is not at par, then we'll be left behind, that the students will also be left behind. So we have to be the guide and lead them to that. So they will not, whether it's possible the role can be replaced. No, basically no, because it's a different role there, really. Okay, thank you.
at par with the student in terms of technology is not easy, I think. Yeah, I agree. But we do need to learn the technology to be able to keep up with everything that is happening in the world today. Yeah. That's the last question for the discussion session. Thank you for all the speakers. Thank you for spending your weekend with us. Thank you so very much. Um, Before the closing, we are going to present the token of appreciation to all speakers for joining us in today's webinar. Allow me to present the certificate of appreciation on behalf of the committee and the dean. Firstly, to Dr. Carl Snyder. Thank you very much for your time. And the second one is certificate of appreciation for Dr. Erwin Martinez Feller. Thank you very much, Dr. Feller. And lastly but not least, certificate of appreciation for Madam Shiren. Thank you very much. An appreciation is also given to all participants for joining us today. For closing, there is also an announcement from the committee that the link for attendance list has been closed and all participants are required to fill out the evaluation form on the link, and it also will be given in the chat box that will be available for today until 3 p.m. GMT plus 7. And the certificate of participation will be sent by email within 10 days, excluding weekends and holiday. Ladies and gentlemen, this wraps up our webinar today. Thank you for everyone, and see you in the next webinar from Faculty of Pharmacy, Universitas Airlangga. Have a very good day. Thank you, everyone. Hope we have a very good lesson learned from the webinar today.